My name is Danny Douek, Dr. Danny Douek, and I am the Chief of the Human Immunology Section at the National Institutes of Health Vaccine Research Center in not Washington, D.C., kind of the metro area. I do immunology, I make vaccines, I study science. So why do I study science? Is it to gain knowledge? No, it's part of it, and that's nice. Why do we do what we do? We do what we do to make sick people better. It sounds a little bit trite and a little bit trivial, but that really is the end goal, is to make sick people better. The partnership between Sheba and the NIH is something that grew unexpectedly and organically. I was at the Weizmann Institute before the pandemic began to do a sabbatical, and the pandemic started, and I thought, what am I going to do? Because the labs at the Weizmann were shut down. So I contacted some of my HIV friends, because I'm an HIV scientist, and where were they? At Sheba. And we said, well, let's do something to do with COVID. So I started coming to Sheba. We shipped samples back to my lab at the NIH. We did some really interesting COVID work, which hopefully will be published soon, nice collaboration. And out of that, I met tons of people at Sheba. So that's a relationship that developed with Sheba. Out of that relationship, then some people from Sheba, Dr. Yaniv Lustig, who's in the virology laboratory, he came over to my lab for 6 months to do a sabbatical. We taught him a ton of stuff. He brought it back to Sheba. So it was clear that we were going to carry on collaborating for the near term and probably for the future. And the collaboration is on pandemic preparedness. It's a good question. I mean, you know, the NIH, we have tons of money, tons of smart people, lots of nice toys with LED lights and bells and things, and Sheba doesn't have as much money. So what does it do? Sheba uses its smarts. So I've always been incredibly impressed, not just with Sheba, but with Israel, that given a budget which is much less than the budget I have to play with at the NIH, Sheba uses its smarts to produce incredibly high quality data and clever ideas. You know, it's the mother of invention. So I think between the two of us, it's a match made in heaven. It's really fantastic. Look, if scientists anywhere in the world work on anything that makes progress towards making sick people better, that benefits humanity. Is there anything special about the relationship between the NIH and Sheba? Yeah, I think there is. I think it's that we are thinking, we have the same vision, right? Israel, let's take the pandemic as an example, the COVID pandemic. Israel was really ahead of everybody else in terms of giving the vaccine to people, in terms of boosting people. Okay, remember the third dose, the booster dose? Israel was the first country in the world to do that. When it came for the US FDA to hold its committee on whether or not to give the booster, it was Ron Milo and Sharon Alroy Price from Israel who gave the evidence of the Israeli experience to the FDA committee, and that helped a lot in convincing them to approve the booster. So Israel and the US think in parallel, the visions are in parallel. So it's a natural collaboration that we should have. Also, pandemic preparedness, pandemics are international, they're global. And so from the NIH point of view, we need partners globally, not just in the US. So it's natural that we should work with Sheba, with Israel, a country that's highly developed, very smart, does fantastic work. Because it's fun and you're making sick people better. I mean, this is going to sound terrible, but there are some people who tell me what they do, like at a party or something. They tell me what they do. I'm not going to give an example because I'd probably offend someone who's listening, but they tell me what they do and I can't help myself, and I just say, why? what's the point? And, you know, being in healthcare, whether you're a scientist making discoveries, or a doctor, or a physiotherapist, or a nurse, or anyone in this building, you are affecting people's lives for the better. That's a fantastic thing. You go home at the end of the day and you've done that. You've made the world a better place. I don't see the point in doing anything unless at the end of your day, at the end of your life, you've made the world a better place.